Welcome, Greek U Nation, to episode number 612 of the Fraternity Foodie Podcast. I'm your host, Dr. Mike Ayalon, CEO of Greek University. I'm a speaker and an author. Our sixth book just came out. It's called I'm So Beautiful, It's Ridiculous: Unleashing and Promoting Strength, Self-Worth, and Real Sisterhood. So go and pick up that book on Amazon or Barnes & Noble today. We call these episodes the Fraternity Foodie Podcast because there is nothing like great food to bring college students together. Fun fact, I don't think we've ever had an OBGYN on our show, but today is your day for everybody who has been waiting patiently for 600 episodes. Here you go. And the reason why is I've really been totally fascinated recently with the declining fertility rates that we're seeing globally. And I'm wondering, what does that mean for us as humans going forward? I think there is going to be implications as a result. So I know just the person to ask. Dr. Marina Straszak-Suri is an OBGYN with over 30 years of practice dedicated to women's health, fertility, and reproductive education. With a unique blend of clinical expertise and a deep commitment to evidence-based holistic care, she empowers individuals and couples to take charge of their reproductive journey. Dr. Marina is also a passionate educator and mentor with years of experience teaching medical students, residents, and healthcare professionals through her work as an assistant professor at the Faculty of Medicine, University of Ottawa. She is known for her warm, accessible teaching style and ability to translate complex medical science into practical, actionable guidance. Welcome to the show, Dr. Marina.
Thank you. Thank you. I'm so proud to be your first OBGYN. I'm going to set a trend.
Yeah, I mean, it's not typically something that I talk about for obvious reasons. However, it does take two to tango, and I certainly am concerned about some of these fertility rates that are dropping globally. I do think that there's going to be an impact on the human race because of it, and I think it's time to talk about it, and it's time to talk about it early with college students because really they are the future, and I think having those
Absolutely.
discussions is critical, right?
Yeah, yeah. I think the implications of what is going on is really kind of worrisome because if we have such low rates now, in 20, 30 years, there's not going to be a workforce to sustain our society.
Yeah.
And we need that.
Yeah.
Somebody has to pay the taxes, so robots won't do the trick.
No, robots are not going to do the trick. And, as you know, I mean, this whole social security system that was set up many decades ago really is designed on the fact that, hey, the workers are going to take care of the older people in society. And if we don't have enough workers, to your point, we are in big trouble. We are in very, very big trouble. So I'm glad to talk about it with you today. And you've been an OBGYN for over 30 years, so you have tons of experience there. And you really are able to combine the medical science with a very holistic approach, which is not necessarily everybody's approach, but it's lovely to see. I'm wondering what inspired you to bridge those two worlds of medical science with a holistic approach.
So I got very interested in functional medicine about 20 years ago. I actually remember what sparked it, and that was Dr. Mark Hyman's first book called Ultra Wellness.
Mm.
And he's the one who's really brought in functional medicine to the forefront. As an intern, got mononucleosis or Epstein-Barr virus, and I was off work for a couple of months as an intern, and I was at risk for losing my internship completely. And I was actually so exhausted at the time. That's what I wanted. I wanted to withdraw and restart the next year. But I had this pesky boyfriend who ended up marrying me, who said, you absolutely cannot lose this year. You have to go back to work. And he pushed me till I went back way before I was ready. But he also supported me greatly in doing so. But I always felt that after that, I never recovered completely. I pushed myself through an obstetric residency, which is very, a lot of nights, a lot of hard work. And so, all of us were tired. So it was silly to complain that I'm exhausted because we were all exhausted. And, I started my career after that and having kids and started to practice, but I always felt I feel like I have chronic fatigue, but I dare not say the word because 40 years ago, chronic fatigue was considered like a made up symptom. Now there is a slightly different approach. It's still not totally acceptable as a diagnosis, but I think people are much more open to it. So when I found out about functional medicine and the approach to disease, it made a lot of sense to me. And it really started making sense as to why I might have gotten mono as opposed to somebody else, what the risk factors were. And I really started looking at things very, very differently for myself. And then in the end, I started bringing elements of that into my practice. Now, I wouldn't consider myself a functional medicine doctor at all because they require a lot more time. The way that we're paid in Canada, you don't have that much time with the patient. Functional medicine doctors will spend 2 or 3 hours taking a history. I mean, I can't do that,
Hmm.
but I can bring elements of what I've learned in for my patients, and my patients have really appreciated that because it has made a big difference in their lives.
Yeah. Your book is fantastic. It's called Optimize Your Fertility Naturally, and there you share research-based strategies for improving fertility. I'm wondering what motivated you to write it? Are you concerned like I am about the future of society?
I certainly am, but it was actually personal motivation.
Mhm.
My daughter graduated from medical school 2.5 years ago, and she was older than her classmates. She had done 2 degrees before. So we were celebrating her 31st birthday shortly after she graduated. And she pulled me aside and said, Mama, for my birthday, what I'd really like is for you to freeze my eggs, pay for freezing my eggs. And, I shouldn't have been shocked. I'm an OBGYN. People ask me this all the time,
Mhm.
that when it comes from your daughter, you sort of go, wow, I guess she's worried. Yes. And she should be. And I thought my initial reaction was, yes, I want grandchildren. I'll do what it takes.
Mhm.
But my second thought was, boy, you're going to go into a residency where you're going to be. She went into emergency medicine at the fifth biggest trauma center in the US. Okay. So I said, you're going to be exhausted for the next 3 years of this residency. You don't want to freeze exhausted, tired eggs because they're not going to be high quality eggs. And nobody talks about this. People go for freezing eggs and IVF, and they're never really addressing the issue is, are your eggs good quality? There really isn't a measure for quality of eggs when they're inside you. The reproductive endocrinologists who do IVF do use artificial intelligence. When they extract eggs, they will actually photograph them. And artificial intelligence using, just the degree of the homogeneity in the cytoplasm, or, how the membranes look, they can predict the percentage chance of fertilization.
Hmm.
So that is a measure of egg quality, but you can only do that if you extract the eggs, not when they're inside your ovaries. But if you look at the research and you see what improves your chance of fertilization, you're improving egg quality. So that there's a direct correlation.
Mhm.
So I started looking at, what lifestyle changes can improve fertilization rates without
Wow.
doing IVF. And
Mhm.
there's a lot of evidence out there. Like 300 papers, articles later, I wrote a book
Wow. So give us
because I
some of
thought
that
people have to know this.
information. I mean, what lifestyle changes should college students and younger women, what should they be doing in terms of their lifestyle in order to improve fertility?
So, in fact, everything we do in our lives, our diet, our exercise, our sleep, the way we handle stress, and particular one thing I talk about because it's not talked about, it's the elephant in the room as far as I'm concerned, is our exposure to endocrine disrupting chemicals in the environment, of which there are many. And we're all exposed. And you hear these stories about fish that have both sexes, or frogs that have both sexes, or men's sperm counts have decreased by over 50% in 2 generations. These are due to toxic chemicals. And though we can't change our environment, we can mitigate. We can do things to avoid. We can learn about what chemicals are in which things we use, like our personal care products are full of endocrine disrupting chemicals. Some are worse than others. So there's actually an app. I don't know if you're familiar with the Environmental Working Group in the
Okay.
EWG. This is
Okay.
an organization in the US. It's a not-for-profit group that educates about pollution and how to mitigate the changes from pollution. So they have an app you can download on your phone, which is called the Healthy Living app. You can actually scan products in the store before you buy them, and it gives you a toxicity rating. So if your regular shampoo is really toxic, you can then find one that is less toxic, and you can start, switching up all of your cleaning products, your personal care products in your house to improve your environment. So that's one thing you can do, but they actually have many things you can do. So I send people to the website ewg.org to learn about how to buy a good water filter, because now another thing that they do, which is really interesting, they do it in the States and not in Canada. I'm so jealous we don't have this. But in the United States, you can look up by your zip code. There's a tap water database, and you can look up what toxins are in your municipal water supply. So my daughter moved to a small town in New Jersey. So of course I go on the web and start looking up the water supply. And I'm horrified because there's 13 contaminants that are way over what they should be. One of them was chloroform at 248 times the upper limit of normal. The chloroform used to be used to put people to sleep. I don't think they use it anymore. They have better agents now. So I don't know what it's doing in the municipal water supply, but it's there. Then there's hexavalent chromium, which I don't know if you remember Aaron Brockovich
I
and
sure
that,
do. I
that
remember that
movie.
movie. Yeah.
That was what was in the water supply of that town, which was completely shut down and razed to the ground because so many people suffered from cancer and all sorts of other things. That's in our water, and there's trichloroacetic acid. That is an acid solution that I use to burn genital warts in my office.
Oh my gosh.
What's it doing in the water supply? It sounds like, the hospital is, something's coming from the hospital water. I don't know. I really don't know. But the first thing I did was buy a really quite expensive reverse osmosis countertop filter and had it sent to her house,
Nice. Nice.
because you can do something about these things, but unfortunately it costs money. Any water filter is better than no water filter, and there's different levels of water filters. So the Environmental Working Group actually publishes a guide on how to choose water filters, what the differences are. So they really educate people, how to do these things, but most people know nothing about it because
Yeah.
doctors don't talk about it. They're not taught about it in medical school,
No.
and they have no idea what to do about it. So
Hmm.
it's more the functional medicine, holistically trained doctors who are more concerned or more knowledgeable, know more what to do. So I tried to, put all of this in my book and say, this is all important,
Yeah.
and start
Yeah.
doing this. The earlier you do it, the healthier you'll be.
Yeah, we need to go to the hospital there in New Jersey and find out how all of this is ending up in the water supply because that's some very strange contaminants that are
Yeah.
ending up in the water supply. Very strange indeed. Now, we should talk about the timing of all of this because many of our listeners are college students. You're talking about 18, 19, 20, 21-year olds. And for the most part, most of these women are not really thinking about pregnancy at this point in their lives. Just, just like your daughter. I mean, they're thinking about their careers, they're thinking about going to med school, to law school, whatever it is that they want to do. So, why do you think that our listeners should care about reproductive health today at this juncture?
Because the earlier you do these things, the more you benefit in the long run. But what also concerns me about young women, a lot of young women are having more and more menstrual problems. Like they have diagnoses like endometriosis and polycystic ovarian syndrome, which I'm sure are made worse by the endocrine disrupting chemicals. So they go to their doctors and say, my period hurts, or I'm not getting my period. And what ends up happening is they usually also need birth control. So they're put on the birth control pill, which artificially gives them a regular period and gives them contraception. Great. So they forget about the underlying problem until 10 years down the road, they want to get pregnant. They go off the pill. And what do you know? The problem's still there. It hasn't been dealt with.
Hmm.
So I really want young women to know that there's a potential fertility problem if their periods are painful or irregular, and it shouldn't be ignored. It should be investigated so that they can start making the lifestyle changes that will help them in the long run.
Yeah, that's really helpful. I appreciate you talking about that. Are there any early warning signs that a woman's reproductive health might be suffering? And what can they do about that before it gets really serious?
So, as I was saying, irregular or painful periods are certainly a sign that there might be a fertility issue.
Hmm.
So they should have investigations to see if they have endometriosis. Now, the problem with investigations is ultrasound often doesn't show it, and it's often a presumptive diagnosis. But if a woman's pain gets better on a birth control pill, and that's a good indicator that she likely has endometriosis. So at least the conversation should be had instead of ignored, and saying, this could potentially be a problem. So at some point, you will want to address it, maybe not now, but later. Same thing with polycystic ovarian syndrome, because the treatment for that, we do have natural supplements and investigations that should be done. And often it involves changes like trying to lose weight, which takes time and effort. So the sooner that you start doing those things, the sooner that you can try to correct the abnormalities and hopefully help fertility.
Hmm. I'm fascinated by this whole conversation because what you're saying is that there's a connection between diet, exercise, and sleep with reproductive health. And I had no idea. Can you talk a little bit more about that connection that exists between the two?
For sure. So there are studies that show, for instance, the more fast food a woman eats, the lower her fertility rate. So there's a direct connection there. There was actually a book published in 2009 called The Fertility Diet by Dr. Jorge Chavarro. They were using the nurses' health study. They were looking at the health of 18,500 nurses. So it was quite a big study. And the studies had many branches, like they were looking at different things. But one of the things they were looking at was fertility rates and the diet that they were having. So they came out with 10 points of, what was associated, what dietary changes were associated with higher fertility. And at the time, because this was in 2009, they said, okay, trans fats was something that they noticed. More trans fats decrease fertility rates. Now, trans fats are usually artificially created fats, which are meant for long-term shelf life. They have been found to be very unhealthy. And in fact, they are largely banned unless they're in very small quantities. So, that's sort of old news. We have progressed beyond that. But they also realized that, for instance, folic acid, which is a B vitamin, was very important for good pregnancy outcomes and for fertility. So it's been for the last 20, 30 years, it's been recommended that women should start on folic acid before trying to get pregnant. The issue is that the folic acid that is in most vitamins is synthetic. We now know from genetic studies that about 70% of the population does not absorb synthetic folic acid properly, and that you should give the bioidentical methylfolate to these people. Problem is, most of us have not had genetic testing, so most of us don't know. So really, the better thing to do is to give everybody the methylfolate. But this has not been accepted by conventional medicine yet. So again, it's mostly functional medicine doctors. And there's a naturopathic doctor in Australia whose work, she wants to change this for the world. So she's trying to do these studies to prove that the methylfolate is better than the synthetic folic acid. She's a long way to go. It's expensive to do those studies, and it's very hard to change conventional medicine. I don't know when that's going to change, but she actually said that if you don't metabolize the synthetic folic acid, it can remain in your bloodstream as unmetabolized folic acid. And there's some evidence that may cause cancer. And she believes that it may be causing anxiety in the population, which of course, so many people are suffering from anxiety. Now, this has not been proven. And again, it's going to take a lot of studies to do this. Conventional medicine does not even look at this.
No. Hmm.
So,
So here's what I know about college students. To your point, they have stress, they have anxiety, right?
mhm.
And also, I'll throw in another one, they're not sleeping enough. I just came back from a college campus and did a presentation in front of 2 or 3 thousand college students, and you can just see it in their faces. As I'm walking around, even before I get up on stage, I'm like, none of you guys are sleeping enough. I'm just telling you, you are not sleeping enough. So, what are some effective ways that we can reduce the impact of stress, anxiety, not sleeping enough on reproductive health? Is it just a matter of, I don't know, avoiding fast food and trying to cook at home? What should they do to reduce the impact on reproductive health?
So, again, returning to diet
Yeah.
and supplementation,
Hmm.
there's a new field of medicine called nutrigenomics. Are you aware of this at
Never even
all?
heard of it.
Okay, so you know all the genetic testing that people were doing, like 23andMe, which unfortunately went under because that was the cheapest way you could get genetic testing done.
Yes.
Now it's going to be more expensive, but there still is a lot of testing that you can do, but you have to pay extra for.
Mm.
So the advantage of doing this testing is nutrition and genetics collide in terms of how you can measure slight genetic variations in how we metabolize nutrients. And, these are all biochemical enzymatic pathways. Enzymes are proteins that help facilitate a biochemical reaction. So it's very important that our enzymes work correctly, but there's genetic differences in how well they work. So even for metabolizing drugs, for instance, one person will metabolize the drug more slowly than the other. So this is personalized medicine. We need to be giving individualized doses according to your genetics, but it's not happening fast enough. Now, for people who are interested, you can get this genetic testing done, and it can tell you if your enzymes are not working properly, you need to boost your cofactors. Cofactors are things like vitamins and minerals that help the enzyme work properly. So that means that some people need higher doses of specific vitamins and minerals than others. So according to these genetic tests, we can personalize your requirements. So I would love to see this genetic testing being done everywhere,
Mm.
but it's not happening. My daughter went through medical school 2 years ago. She was taught zero about this,
Oh, yeah, yeah.
zero. So how is this going to change? People need to know more about this.
Hmm.
So my contention is, if you are thinking about getting pregnant and you're serious and you're worried, do this. Optimize your diet and supplementation according to your genetics. There's a really interesting study done by a couple of doctors who are functional medicine doctors in Oregon, and their daughter's a nutritionist. And they looked at the different genetic variations that had implications for fertility. And they did a test of 40 different, these are called SNPs, single nucleotide polymorphisms. They tested 40 in a group of 100 Medicaid patients when they got pregnant. And they basically gave them nutritional support according to their genetics. And then they compared their outcomes to 100 private patients who had regular pregnancies and regular follow-ups. You would expect that the Medicaid patients might do worse in terms of their outcomes, but with this supplemental support, they had significantly less gestational diabetes and significantly less gestational hypertension, which are two big factors that can have health implications for both mom and baby.
Hmm.
So to me, and they have now marketed this test, it's called the Grow Baby test. This should be huge news. I only learned about it because I was researching this book and I went, how come people don't know about this? This is amazing.
Yeah.
This could change antenatal care. But you know what? Nobody in conventional medicine talks about it.
No, no, not at all. Maybe we should talk about that too, because, it seems like you're very passionate about solving this declining fertility rate problem. Why is this so urgent? There's obviously a lot of other things that are going on in the world right now. I'm sure, very aware of everything that's happening politically and otherwise. Why is this such an urgent issue to tackle fertility rates?
So if you want to just sustain a population at the same levels, each woman should have 2.1 children. So that is the, fertility rate to keep the society at balance. So right now, I believe the latest figure for the United States is 1.63. Canada is 1.23. The the lowest fertility rate in the world is in South Korea. I believe it's like 0.6, but don't quote me, but it's really low. Okay. And in Japan, it's very, very low. So imagine in 30 years, there's going to be this hole in the population. There's going to be all of these old folks and nobody who's, young and working hard. So Japan has already thought ahead. They have a program where they're importing people, caregivers from India to support their elderly because they know they already have this problem. It's going to be worse in 30 years. So they're going to have to start thinking outside the box of, mostly immigration, because Africa still has the highest fertility rates in the world. They are declining, as ours are, but not to the same level. They're still on the positive side. So I can imagine that everybody is going to want African workers in 30 years because who else is there, to support the society?
Hmm.
But is that gonna fly? Because the Africans are going to say, no, we need them in our to support our society. We can't give up our workers. So
Mhm.
what is going to happen? I don't know. Like, sure, artificial intelligence will help to some degree, but you still need people to pay taxes.
Yes. Yes, you're still going to need the workers to pay the taxes for sure. Are there any myths around women's fertility that you want to see disappear from this planet once and for all?
Yes, that it's totally a woman's problem. We
Amen.
we
Amen.
we
Men
know
need to be a part
now.
of this.
Men have sort of like, oh, I'm just a sperm donor. We
Right.
now know that sperm are really important for the formation of the placenta. It's mostly sperm. No placenta, no baby. They are just as important as we are. And the fact that men's sperm counts are less than 50% than they were 2 generations ago, and they're continuing to decline. This is a huge problem. So, and men don't find out until there's issues, there's
Right.
problems, right?
Right.
Some people say that men should be doing their sperm counts way before they're even thinking about getting pregnant, just to know if there's a problem.
Mm-hmm.
And it is a marker of their health. If there's a problem, there's a reason.
Yeah, for sure, for sure. Another thing that I want to talk about too is I think there's a lot of young women and also young men too that have difficulty advocating for themselves when they go in for a doctor's visit. Often they feel dismissed. They feel like their concerns are not being taken seriously. And a lot of it, I think, has to do with, to your point, how much time you're given with each patient because of the way that insurance works, whether it be in the United States or Canada or wherever. Doctors are just not given the time to meet with patients and do a full investigation. So, how can young people advocate for themselves during that visit?
I'll tell you, it's not only young people, it's older people as well.
Yeah,
They feel very dismissed by doctors who don't have the time or the energy to deal with the issue.
yeah,
And that's a problem. It's a problem because there's too few doctors. And I think people have to stand up for themselves and say, I know there's an issue. I need this dealt with. And if you're I think it's to the point where people need more than one practitioner, a conventional one and an alternative one. And you need to sort of have open-mindedness at both ends, hopefully. That's the ideal situation.
yeah.
You know?
Wow, that's a big problem that we're going to have to deal with. And I don't think it's getting any better. I think it's getting worse. I think
Getting worse. I
you, as
agree with you.
doctors, are given less and less time every single year with your patients. And it is a problem. I mean, you take an oath for your patients and their health, but if you don't have enough time to work with them, I don't know where we're going here. I mean,
Hmm.
this is
Hmm.
really bad.
Well, I think people have to basically, take control of their own health and realize that they can't rely on a doctor to tell them what to do. They
No.
need to find out more. They need to advocate for themselves. They need to read. Unfortunately, our bodies don't come with user manuals. They should. They really should.
Yeah,
um, and it's up to each person. If health is important to you, the problem is when you're young, you take it for granted.
that's
The
correct.
older we get, the more we realize. And then when you run into a fertility issue, you really realize, oh my goodness, I probably should have done something way earlier.
Yeah.
So I really want young women, especially, to realize this is important. Don't take it for granted.
Yeah, that's wise words. And especially as you're talking about, I think the younger generation, they can start doing things today, like we talked about in this interview, in order to ensure that there aren't problems later, or at least minimize those problems. So,
That's
where
right.
can our listeners go to find your book? It's called Optimize Your Fertility Naturally. And also, where can they go to connect with you? Maybe they want you to come and speak on their college campus about some of these issues.
Oh, for sure. So my website is drmarinaobgyn.com. It's well, what's written below my name, drmarinaobgyn.com. And there's information about my book. It's not out yet. It's hopefully mid-January, but this is my first time writing a book, so I don't know if the timelines will work. But there is a wait list. You can sign up for a wait list, and then you'll be informed when the book comes out.
That's perfect.
And yes, so I'm trying to speak more about it to let people know, and they can reach me through the website. I also do a weekly blog on fertility issues. If they're interested, they can sign up for that.
Fantastic. All right, so just go to the website. It's
Mhm.
drmarinaobgyn.com. I want everybody listening to go to Dr. Marina's website. I want you to sign up so that way you know when that book comes out in January or February. We'll see. To your point, I think I've written already 6 books. It always takes a little bit longer than you think. Let's just
That's what
leave
I
it at
suspected.
that. So we hope it's going to be out at the end of January. Maybe it's going to be into February. But if you sign up, that way you'll get notification by email as soon as it's ready. So that way you can go and buy the book on Amazon or wherever it's going to be sold. And I do think this is a bigger issue. I think a lot of people are not talking about this issue. It is a huge issue. And more people need to be talking about it. So I appreciate the work that you're doing in terms of coming on the podcast, discussing the issue, writing the book, and doing everything that you can to alert people to this upcoming issue that more people need to be paying attention to. So thank you.
Thank you very much. Can I just tell you quickly? There's a
Sure.
very interesting documentary called Birth Gap about this issue. The documentary maker traveled the world, interviewed people in different countries. He's more of a data analyst, and he's looked at the trends. It's very interesting. It's on his website, birthgap.org. So if you're interested in that, it's a good watch.
Yeah, all right. Birthgap.org. I'm going to go and check out that documentary. I think it's really fascinating to me. And to your point, not enough people are talking about it. But here we are on the Fraternity Foodie Podcast talking about it. So I appreciate you. Thank you so much. And to our listeners, if you enjoyed this conversation with Dr. Marina, I want you to like it and I want you to share it with other college students that also need to be aware of this issue. We appreciate you being with us today, and we'll see you on the next episode of the Fraternity Foodie Podcast. Bye for now.